very good evening. You're watching the India Development Debate. I'm Tamanna Inamdar. Coronavirus fears have reached Indian shores once more, with 2 new cases at least being reported this morning, one from Delhi and the other from Telangana. Meanwhile, the death toll globally has crossed the 3,000 mark. Europe has increased its risk level to high from moderate, and the US has reported at least 2 coronavirus deaths. The virus is unpredictable and seems to have left authorities all around the world unprepared. The question is, how ready are we? To talk about this, I'm joined this evening by Dr. Mahesh Devnani, Associate Professor and Postgraduate Institute of Medical Education and Research, and Amir, Indian economist. Welcome to both of you, and thank you for speaking with us today. Dr. Devnani, let me begin by just getting your take. And we've been speaking from when the virus was first detected. We had 3 cases in India, in Kerala, and they came out of quarantine, all was fine. It's back on our shores. Can you explain how you see the patterns emerging here?
Thank you, Tamanna, and good to be back on the show. At least 3 cases have been reported today, as you mentioned, 2, one from Delhi and one from Telangana, and 1 more case has been reported from Rajasthan as well. This was expected earlier. Also, when we received cases in Kerala, this was expected. But you can see that for last 1 month, things have been pretty good and under control in the country. So we'll see how it emerges. But for now, I think we are quite prepared, and the surveillance system which is in place, the detection system and the containment efforts are actually working. And as you must have heard, the Honorable Health Minister earlier in the day was briefing the press, and he detailed all the preparations that have been done. So from that point of view, from containment point of view, the Kerala did a wonderful job. And as you mentioned, all 3 cases were recovered and were out of isolation. So, and the contact tracing also worked, that no new case was detected from those cases, and I hope that the same will be the case this time also for all these cases. And as I mentioned earlier also, we have to be on high alert and prepared, and there is no need to panic. There is no need to scare. These are only 3 cases, but as the things are emerging worldwide outside China, we have to be on alert.
Yes,
and the things
yes, Dr. Devnani, frankly, okay, I'll tell you what the problem is. I'll tell you what, you're absolutely right. We should not panic. There is no need to panic because it's not going to help. But when you say everything will be fine, I don't know how sure people really are, because look at the speed with which the numbers have gone up, whether it's in Europe, in Italy, in South Korea, in Iran. And in India, we've had no news of any positive cases so far till this morning after the last 3 in Kerala. The question is, do we really know enough? Do we know enough about whether this is now from person to person? How quickly it can spread? Do we have enough screening facilities is the big question. At what point do you have to go and start screening? So these answers are not yet very clear.
So let's understand. So one is the containment. So right now what is happening is that all those who are coming back from various different parts of the world are being screened at the airports, right? That is thermal screening. That is the first point of contact where the screening has been done. Once they find that someone has a high risk, they are actually isolating them and are testing also. So around 3,000 tests have already been done. And the community surveillance is also going on. Then the surveillance in terms of contact tracing is also going on. So from that point of view, the things have been pretty good till now. That's what we need to understand. And we also need to understand, as you mentioned, the human-to-human spread has not yet been documented in the country. And there have been cases in US about the community spread, which is entirely a different thing. So human-to-human spread or the community spread has not yet been detected here. So there is no need to scare.
Let me go to Professor Amirullah Khan, and welcome back on the show again. We've spoken in the past about the coronavirus, Professor, and we have seen how in preparation for this, there are complete industries which are on the brink right now. Travel and tourism, of course, at the foremost of it. We've had cancellation of large events. How far do you see this going? We also have global leaders now sitting up and taking note of how serious the impact can be on business.
Yes, Tamanna, it is serious, and the fact is that when we are looking at the impact of this virus, we are just questioning when. It is not a question of whether anymore, and therefore, what we know for sure right now is that we are vulnerable. Uh, Dr. Devnani talked about the surveillance at the airports. The lurking suspicion is that maybe we are being a little smug about this and think that thermal screening at airports would be just fine and just enough. You see, thermal screening at best, catches about 30 to 50% of the cases. So you could actually have something like 70% of cases undetected. India has been saved largely because we don't have too much traffic from China. Those countries that have traffic from China are facing the brunt, which is Iran and South Korea and Singapore, and we are far from being prepared. Dr. Saab is absolutely right. We cannot at this point even talk about being scared or being or getting worried, but we have to be better prepared. We have to be prepared. We cannot remain complacent. And in this, what I must tell you is that given the spread and given the fact that we still don't have have a full understanding of this virus, we have to ensure that at all levels we are ready for this. And when I say all levels, I mean that it cannot be a state-led response. At the moment, the entire responsibility seems to be with the state, and the state is giving these mega statements saying everything is fine, don't worry. It has to be at the community level. You can't have something like this which will be run by a few people who run our health systems. Kerala, we use Kerala as an example, but Kerala is not really like the rest of the country. Kerala has handled Nipah, and if Kerala has handled it, it certainly does not mean that UP and Bihar will be able to handle it. So I think my worry is that at the very top, we are being very complacent. The Chief Minister of UP
Are we being complacent? I'm going to
saying that
yes.
This is no disease.
Yeah. Amirullah Khan, give me a second.
He said it's no disease, that it's...
Yeah, I'll come back to you. I'll come back to you on that. I just have Peter Cardillo with me, and I have him just for a few minutes. And I want to use that opportunity to get a sense of how the world is really looking at this. Mr. Cardillo, thank you for speaking with me. You will remember we have spoken earlier at the start of all of this, when it was still contained in China. And I remember you telling me very confidently that you don't think this is going to be a big deal. It's going to blow over in a few weeks, and then we'll be done with it. Is there a different picture emerging?
Well,
today?
Obviously, there's a different picture emerging now, because if we look across the globe, it seems that every nation is beginning to report victims. And of course, in Europe, the situation is somewhat a bit more serious if we take a look at what's happening in Italy. And here in the States, just last night and today, there were reports of new victims. In fact, one here in New York City. So the market seems to be very concerned about that. But I still believe that, will we see millions of people die from this? I don't think so. The numbers in China are beginning to come down. The problem is that it's spreading beyond the Asian borders. And so I think it's safe to say that a lot of nations are now taking some serious moves. And so hopefully, even though that it's spreading, that we're not going to see millions and millions of people die from this virus.
Well, do you think millions and millions of businesses will survive, Peter Cardillo? Now this is a virus which so far we know has a 2% mortality. There have been some cases of relapse, which is even scarier. But the fear factor may, be lethal for several businesses.
Question. Now, the economies are going to suffer. There's no question about that. There's a good possibility that we could be headed for a short-term global recession. And in fact, if you look at the numbers that have come out of China over the weekend, the PMI, they certainly suggest that. And certainly Europe is not going to escape that. And there's a good possibility that we might have real slow growth here or even negative growth. Look, that's what the markets are telling us. If you look at what's happening with the yield factor, we see yields plunging in the United States. And in fact, just this morning, the ECB said that it stands ready to act. And, you know, with negative interest rates there, the only thing they can do is really begin to buy assets in a big way, which would mean quantitative easing. I don't think that's going to be the case here in the States. I think we will get a move by the Federal Reserve, but I don't think it's going to happen before the 17th, the March 17, 18 meeting. So we just have to wait for a couple of weeks. In the meantime, the markets certainly, the markets remain extremely volatile. And I think that, you know, we still have a little bit more to go on the downside before we see any turnaround.
Okay, two questions, Peter Cardillo. One is, do you see the need for a coordinated economic response, financial response from nations around the world? And secondly, how is India looking right now in the overall context? We've had our first 2-3 cases after a lull of about a few weeks reported today. We don't know how far this will go. But at this point, how is India looking in the bigger picture?
The first question is, do I think central banks will respond? Yes, they will respond. Will they do it in a coordinated fashion with one announcement? I don't think that's the case, unless they wait for the United States. As far as India is concerned, they are taking measures. The question is, you know, are those measures going to be enough? But so far, from what I've read and what I've heard, I don't think that there's been any really major spreading throughout India. It's somewhat sporadic, just like it's here in the States and other parts of the world.
Absolutely. Thank you so much, Peter Cardillo, for joining us. Peter Cardillo there, popping in on the show to give us a sense of how the world is really looking at the coronavirus. Let me go back to you, Professor Amir Khan. You were giving us the example of what UP Chief Minister Yogi Adityanath has said about the coronavirus, saying, you know, do some yoga and it might help. I get your concern, but isn't the bigger concern really about how our health system is poised to deal with a large number of cases with quarantines if that situation emerges, and we hope it won't?
Yeah, Tamanna, you know, that is the real issue, that are our health systems ready? We know the state of our health systems already. And with something like this, which is new and which is something that people haven't understood yet, will we be able to provide that high quality quarantine that is required? We only have that in some military hospitals, and those can handle very few patients. So it's important for us to get serious and now start talking about the fact that we need community-led responses. Patients should not be, ideally, patients should not be coming to hospital. They should be in communities where they are provided with food and drugs, where they remain, they don't get other infections, they don't infect other people. Individuals are told as to the fact that they should be wary, they should be careful of infection around them, they should know what to do if someone near them is coughing, they should know about hand washing. You see, these are the serious issues that we should be talking about, not just give these motherhood statements that everything is fine, we've got everything in control. That is not true. And it is, while it is absolutely true, I repeat, that we should not be spreading panic, but that doesn't mean that we wish it away. On the economic front, what we have to understand is that our supply chain is going to definitely get distorted. See, all the ships that left in January, they will port in the next 15 days or so. So after the 15th of March is when the supply chain is going to get hurt the most. and therefore we need to be ready for the fact that there will be some production delays, there will be some snags in automobiles, in smartphones, in pharma in April and May, and we should accept it. There is nothing much that can be done right now. We can't simply overhaul supply chains and change them overnight. So those are the serious issues on the economic front, where we need to ensure that yes, we will have some delays. On the health front, on the public health front, where we do a mass education program, an awareness program, an ability, a program where we actually begin to talk about it, and serious people who are responsible start talking about this rather than push it under the carpet.
Okay, so are we pushing it under the carpet? Well, Health Minister Harsh Vardhan today held a press conference and gave quite a few details of what the Indian government is doing. He, of course, reiterated that there should be no panic. There is also a helpline for anyone facing symptoms. We did try calling the helpline and they responded quickly with clarity. So that's, you know, one real positive point out of this. But let's listen in to what Harsh Vardhan said.
अभी तक हमारे पास टोटल पॉजिटिव केसेस जो भारत में अभी तक टेस्टिंग में पॉजिटिव आए हैं उनकी संख्या 5 हो गई है। अभी हम 12 देशों से आने वाले पैसेंजर्स जो हैं उनकी यूनिवर्सल स्क्रीनिंग कर रहे हैं। अभी हमने ऑलमोस्ट 19 और लैब्स को आने वाले 1-2 दिनों में और फंक्शनल करने के लिए तैयारी कर ली है और इसके लिए निर्णय लिया है। सारे देश के लोगों को केवल हमारा ये कहना है कि इस संदर्भ में पहली बात तो कोई हम किसी तरह के पैनिक सिचुएशन में ना पड़ें। वेयर एवर इन डाउट तो सिस्टम के साथ संपर्क करें। हमारी जो टेलीफोन लाइन है उसके ऊपर कोई भी क्वेरी कर सकते हैं।
Well, let me come back to Dr. Devnani. So we know that we have a sketchy health service system, a public health service system at least. What is the most caution that people can take? Because I'm seeing this morph into panic, either panic or complacency, like you know, Professor Khan is talking about that, you know, we Indians are resilient, so we'll be fine, weather will be warm, so we will be fine, the virus won't last here. You know, I'm seeing these two extremes, and the other extreme is of jumping 5 feet if someone sneezes in front of them. Is that also because of a lack of information overall on where to go, what to do, and how to get screened?
Tamanna, see, since this information emerged in December that there is this outbreak in China, I think state governments as well as the central government is providing all the information that is needed in the public domain, as well as the information that public should know, which Professor Khan was informing about the hand washing or, you know, the etiquette for coughing, etc. And we discussed in when the last time 1 month ago I was on your show. So that information is being provided. And as you can see in last 1 month, despite all this surveillance and, you know, detection and testing, labs were increased in number, we couldn't detect it. But yes, I agree with Professor Khan, and we all know that all the health systems in different states are not same. Everyone is not like Kerala. But in last 2 months, there are reasons to believe that the states are working on that, and they have improved their capacities to respond to this. So what I was telling earlier is that till the mitigation part and the surveillances part, it's going till now is fine. But when it comes to the responding to the actual cases when it happens, then we are yet to see how the different health systems of different states respond to and how prepared are they.
No, Dr. Devnani, my concern is the screening at the first point. Have we detected how many cases are actually there? We know that this virus can be dormant without symptoms for days. You know, this is a large country with very crowded areas in some parts, and that is a scary thought, to be honest.
Well, but that is not helping. So what is happening? So we have to be following the guidelines and what the scientific evidence-based guidelines are, right? So if there are patients who, the passengers who are coming back, the first is that even through the IHR also, that is international health regulations, advise us that there should be an exit screening from the port where they are exiting, and there should be an entry screening at the port they are entering. So that is being done. There is this valid point that there might be patients who get missed. So for that, there is community surveillance that is going on, that people of high risk are also being followed when they are leaving the airport in their communities also. And then testing is also being done. If anyone is having symptoms, those who have returned from these high risk areas, if they have any symptom, they have been advised to report to the health system immediately, and then the clinicians are taking care of that, whether the testing has to be done or not, isolation is to be done or not, and the contact tracing of those close contacts.
Okay, so follow the process, don't panic, fingers crossed, hope for the best. Professor Ullah Khan, what really can the government do right now to ensure that we don't come to a situation where there are a large number of cases, because we've seen a large number of cases very quickly in nations like Italy?
Yeah. Tamanna, I must say that it is important for the government to now show and articulate the fact that this is a problem that we are going to face. It is a problem that we are getting ready to face, and in this we want civil society, we want the community to come together with us. It will not be done only by the state. The state will not be able to handle anything like this. Therefore, we need all hands on the deck. That is very important for the government to state. That has not been said at all till now. The second, and this is what I'm really worried about. You see, when we start talking like this, and hopefully we don't get people scared, but they are going to, your point that they are going to jump 5 feet when they see somebody sneeze, that's the better option. But you know what I'm worried about is that we go to the other extreme. Let me remind you that when we had the HIV/AIDS scare, and then the stigma that came along with it, and we are a society in India that stigmatizes everything. Once that stigma comes in, then we behave very violently. In this general mood of where we are, where we have people getting lynched and killed for various reasons, that is the danger that we are worried about, that you find people abandoning those who are unwell or doing worse to them, and that is what we must be careful about, that we don't allow fake news to spread. That's another big evil that we have right now. We don't allow people to get really worried about others who fall ill or show symptoms, but they behave responsibly towards them. And for that, I must repeat that it is important for the government to bring in large civil society into the picture.
Well, hopefully those steps will be taken as and when more information emerges over the next few days. We're keeping our focus on the coronavirus right over here. Thank you so much, Ullah Khan and Mahesh Devnani, for joining us on the show this evening. While the coronavirus threatens to harm global economy, and of course, the Indian economy is shaky at this point with what might come ahead. The auto sector seems one of the most vulnerable ones. The BS6 norms are going to be unveiled, and that already has been a speed breaker for the auto sector. Their Feb numbers also don't look very good. And then we're not so sure what the impact of coronavirus is going to be. My colleague Karunya is coming back with all of those details and responses from auto companies and more numbers there. Karunya, take it away.
Do remember the auto sector is already in the middle of transitory issues. They're making a big shift from BS4 to BS6. It's the last leg of that, and adding on to the woes is weak demand, and now some supply constraints on back of coronavirus, definitely for some OEMs who have gone on record to say that yes, our production has been impacted for the month of February. The likes of Tata Motors passenger vehicles, TVS Motors, Hero had given some commentary a couple of weeks back as well. So yes, there are some OEMs which have been impacted on back of this. Even M&M has said that they've seen some impact for the auto division. But overall, if you look at the numbers, there are no negative surprises really. PV numbers seem to be stabilizing overall. Yes, the degrowth still persists, but the thing to notice here is that there's no further expansion in the degrowth. For Maruti, it seems to be stabilizing around 1.5 lakh units, and this is a company which is now selling BS6 vehicles. So they're seeing already good demand for that, for all the vehicles that have have made the shift to BS6 platform. So decent numbers from Maruti, M&M Auto, Tata Motors, PV. Yes, firstly they were a little bit hit because of coronavirus, but otherwise the numbers were largely on the expected lines. Royal Enfield finally seems to show some signs of stability. CV, while the overall sector has been under deep stress and there has been no signs of revival as far as manufacturing construction activity is concerned. Financiers are still very wary of lending money to CV to fleet owners. Despite that, I think the numbers delivered by Ashok Leyland were not bad at all, because we were expecting 9,000 units. They delivered 11,500. Definitely we'll wait for a couple of more months. We'll give more time for BS6 to entirely play out, to actually talk about what the trends are emerging. But right now the focus is completely on clearing out inventory, dealing with the stress of short-term stress of coronavirus and component supplies, etc. Overall, I think it's an inline performance, no negative surprises.
When we come back, we're talking about the GDP data that was released last Friday. We, of course, discussed extensively what it means for the Indian economy. But the upward revision of the first 2 quarters by almost 60 basis points, that is 0.60%, has raised a whole host of questions. Are those questions talking about the credibility of India's statistical data fair, unfair? What's the full story? I'm coming back with that detail after this break. Don't go away.